Did you form any opinions with respect to Ms. Heard?
I did.
What were those opinions?
The results of Ms. Heard's evaluation supported 2 diagnoses: borderline personality disorder and histrionic personality disorder.
In a previous video, I talked about how mental health is becoming a central theme, or certainly a bedrock theme in the trial between Johnny Depp and Amber Heard. Perhaps necessary that all of these things are public in order to show the transparency of the justice system, but it's led to a very polarised and bitter dispute between these 2 people. And sadly, people have piled in on one side and have decided in advance who the victim is and who the perpetrator is. I think that's a sad situation. It appears to me that 90% of people, or maybe even 99% of people, are on the side of Johnny Depp here, and that nobody is seeing any sympathy for Amber Heard's case. And I'm going to stay neutral. I'm not really going to take a side, because I think one of the saddest things about it is, in a domestic violence case, incredibly sad situation for anybody to have to go through. I mean, whatever about the odds that we take when we go outside, at the risk of being assaulted, when you go out in the street, everybody should be safe in their own home. And we have no real knowledge really of what's happening behind closed doors, albeit there is some recordings, and you could make a case that those are selective, and well, they obviously are if they're taken by one side to prove that one side is better than the other. And I suppose one of the star witnesses, so in the previous video I did about Johnny Depp's diagnosis by his own doctor, and now in this video I'd like to look at the Amber Heard diagnosis, not by her doctor but by Johnny Depp's psychologist.
One of the primary things I learned was that she had a very sophisticated way of minimizing any personal problems, externalization of blame, tending to have a lot of inner hostility that is attempted to be controlled, a tendency to be very self-righteous, but to also deny that self-righteousness and to judge others critically against these sort of high standards for moral value, but also to deny doing that, essentially to claim that one is very non-judgmental and accepting, and yet very full of rage, really. And these aren't facts, but
one of the things that I found most uncomfortable really about the trial so far, and really this is about just the mental health aspects of it, which I think is a major aspect of this trial, but it's providing a window into what all of us have to go through in the mental health system. And it shows, I think, the darker side of the mental health system, because here you have therapeutic tools being weaponized in order to make somebody look better or worse than the other side, because everything that goes into the trial, particularly in the States where everything is very adversarial, is very hostile and antagonistic. So you have a kind of a hostile diagnosis of Amber Heard by this psychologist. And the psychologist is Dr. Shannon Curry. Now, she is probably the star performer of this trial so far. She's confident, she is self-assured, she takes absolutely no prisoners. She's an absolute perfect on-point professional.
What's a personality disorder?
to understand a personality disorder, I think it can be helpful first to kind of define personality.
And in a trial especially, where it's got a lot of star value and celebrity value, she has almost matched that and nearly outshined some of the celebrities. She's a really good find by the Johnny Depp team. And so much so that Amber Heard's side has kept on misnaming their own psychologist as Dr. Curry.
Dr. Curry, in answering that question, were you consulting anything?
Dr. Hughes.
Dr. I'm so sorry. Dr. Hughes, were you consulting anything? Dr. Curry's here, I guess, as well. That's a confusion. Right there. Dr. Curry, if you, I mean, Dr. Hughes, I don't know why I keep doing that. My apologies. My apologies. Dr. Hughes, I think it's the confusion of having her in the courtroom.
And it kind of gives an insight on how blinded by the star value she had by her performance. And in some ways they have screwed up by not matching that level of expertise. So she has been a great star performer. Now, the actual methods that are being presented here would be, I would be very uncomfortable with them. Really, what it seems that what has been done is that a psychologist has been hired by the Johnny Depp team to analyse Amber Heard and to put a label or labels or diagnoses on her. And what makes me uncomfortable is that all of these tools are supposedly designed to, in a therapeutic sense, to help people get through struggles in life and find the best solutions for them. And here we have a situation where the opposite is being done in a way. It's a hostile diagnosis or hostile application of a therapeutic tool. The subject, and again, I'm not taking any sides in this, but I'm just abstracting from it and saying and analysing what's actually going on. So you have something that's supposedly a therapeutic tool in order to help somebody being used in an adversarial court session where the objective is not to help the person, but the objective is to land as many blows as possible.
I wanted to make sure that she was alert and oriented to, we call it person, place, and time. That means she knew who she was, she knew who I was, she knew where we were, and she knew the date. That way I can ensure that she's able to participate in the evaluation and understand what's happening. I then administered something called the Minnesota Multiphasic Personality Inventory 2.
Really on the subject, to put a diagnosis on them that suits a certain side in this court case. So it's a hostile diagnosis and very questionable, I would think. And again, it just goes back, even if the diagnosis were friendly, goes back to what I was talking about before and the video I did on 200. We have 200 now categories of mental disorders, and how ridiculous that is, and whether that is helping anybody or making things worse. So I did a separate video on that and all of the crazy new categories that we have, which is something that has exploded in recent years. And as the DSM evolves, and it's now a DSM-5, the categories get bigger and bigger, and there's more and more numerous. And of course, the most recent one and the most popular one at the moment is borderline personality disorder, which is becoming a very popular diagnosis. And I use that word advisedly because it seems it came out of nowhere and it is a very vague category, really. And we all, I think, intuitively know what anxiety is. If you've had anxiety, you certainly know and you feel it. And depression are quite, and even then, I mean, I've done videos on what is anxiety and what is depression because I did have to take a step back and try and sit in it and try to describe exactly what it is, because it is a kind of an internalized feeling and it is quite subjective, really. But borderline is one that's even more subjective again, I think. And I've heard, again, in support groups, a lot of people in recent years increasingly being diagnosed and sometimes being self-diagnosed with borderline personality disorder. And I really wondered whether that was doing them any good or whether it was doing them any harm. But this was, so the two conclusions that Dr. Curry came up with in her diagnosis of Amber Heard were borderline personality disorder and histrionic personality disorder. And it was interesting that she made a differentiation between personality disorders and mental illnesses and mental disorders. And the personality disorders, she said that it's an inherent kind of fault in your personality, and that really grated on me because, again, it comes back to the question of, you know, there's 8 billion people in the world and we all have different personalities. We all have this uniqueness. We all have things that apparently on the outside sometimes can seem like, and can very easily be labeled as disorders, but could be part of our unique fingerprint, which makes us different and which drives us to new and interesting places. Sometimes it might seem that it's a kind of a craziness, but some of the most interesting, nicest people I've met along the road in life have been for the want of a better word, crazy, eccentric, and different.
A personality disorder is some sort of dysfunction in those enduring traits. So as opposed to other types of mental illness, when you think about something like depression, that's episodic. It comes and it goes, and when it's treated with medication, it can pretty much be completely mitigated or minimized in a person's life, and their personality is still there, separate from the depression. When we have a personality disorder, there are going to be disturbances in several different areas that are visible in almost all different facets of their life.
And now we have a pathologizing of this difference with myriad of different categories, and it's looked on as something that has to be driven out and medicated. And again, just the categorization tends to be so arbitrary in itself. But so the histrionic personality disorder, so this is a fault that they're saying in your very personality. So as opposed to a mental disorder, which is something that comes and goes, this is a permanent fault. This is what they're calling a permanent fault on your personality. And histrionic personality disorder, in order to be diagnosed, you have to meet 5 of 8 of the following. So using your appearance to draw attention. I mean, that is something that anybody, I would say, could be accused of and certainly be ticked off for anyone or the vast majority of people. Suggestible and easily influenced, again, a very common one, and really anybody could self-diagnose them as being like that. And thinks relationships are closer than they are. That seems a very vague criteria for me. Vague speech and impressionistic. Vague and impressionistic speech. I'm sure people could accuse me in these videos of having vague and impressionistic speech, but that sounds like an artistic personality, somebody who isn't necessarily going to be terribly logical about everything, but is going to just kind of paint a picture. And that is an equally valid way of describing life or describing a life experience as far as I'm concerned. Seductive and provocative behavior. Shifting and shallow emotions. So, I mean, we all have emotions that shift from one to the other, and shallow emotions, yeah, I'm not sure what that means. Dramatic or exaggerated emotions, so that seems to kind of conflict with the previous one. Dramatic or exaggerated emotions. I mean, some could say, especially with this, and a lot of these criterion, that these are positive things in some cases. Somebody who's in touch with their emotions, somebody who's able to access their emotions rather than being an emotional stone, and a need to be the center of attention. So there are the 8 criteria, and you only have to meet 5 of those. I would say you could diagnose almost anybody to meet 5 of those 8.
One of the hallmark characteristics of histrionic personality disorder is sort of a overly dramatic presentation. We call this impressionistic speech. So it tends to be very flowery. It uses a lot of descriptive words like magical, wonderful, and it can go on for quite some time, and yet it really lacks any substance. So at the end, you're left wondering what was just said or what the answer is to the actual question.
So that seems quite tenuous to me. The other one is borderline. So this is incredibly popular now, and so borderline is, I mean, they're far more serious. Some of the situations here, some of the criteria. The most serious ones are self-harm and explosive anger. Self-harm is certainly an incredibly serious criteria to have, and it's bundled in there with other vague, less serious stuff. And this is kind of the problem. But fear of abandonment, I would say that is part of the human condition. I can't imagine anybody not having some fear of abandonment. Unstable relationships, now the two are probably quite connected there, but again, you could probably, everybody, we've all been there probably. Unclear or shifting self-image, I would imagine everybody has felt like that at some point. Impulsive or self-destructive behaviours, now that is serious as well, so that kind of points to addiction and kind of linked in with self-harm, and that's pretty serious stuff. Again, probably covered by a simple diagnosis of depression, I would have thought. Extreme emotional swings, chronic feeling of emptiness, sounds like depression there as well, and feeling suspicious or out of touch with reality. So there are 9 conditions, and I think you have to meet 6 of those, or is it 5?
So that occurred a number of times, and it also represented the quick shifts you'll see between emotions. So she would suddenly be one way, and then she would become very animated or very sad. And when people are displaying these emotions with this personality disorder, there's a sense of shallowness to it. People who are observing them will feel like it's almost play acting, and they might not be able to put their finger on it, but part of it is because of the rapidness with which the person can switch emotions, and also the lack of substance. They don't really refer to, I feel this way. They might describe emotions, they might describe events, but very rarely, and Ms. Heard did not say, I feel vulnerable. She never really indicated a vulnerable feeling of her own.
Again, these new conditions, I suppose just to strip it back, why are these new conditions and new categories of mental disorders in the DSM? Are they there to help people? Are they there to help people through challenges in life and get out the other end in a better shape? So the question is, these things have been here probably, well, depression, anxiety have probably been there for 100 years as a diagnosis. Some of these new conditions are there maybe 20 years. And I think we would all agree that the evidence is there that mental health is worsening at an alarming rate in the world. You have a skyrocketing of mental disorders, mental health problems, especially over the last 2-3 years. So it would suggest, no, result doesn't imply causation, but it would suggest that this over-categorization isn't helping, and possibly the medication that's associated with all these 200 categories isn't helping either. And that is the ultimate result. What is it that we need to do to help people through these struggles in life? And I've done a video on 15 things I do for my mental health. So a diagnosis wasn't one of them. It wasn't anywhere on that list, and that's interesting, and I'm just realizing it now. But
what is a diagnosis?
A diagnosis is a way that that psychologists, psychiatrists, anybody in the mental health field thinks about a disorder. It helps us to communicate a set of symptoms that a person is experiencing, and along with that set of symptoms, it tells other professionals a lot about how those symptoms might have developed, how that person might behave, perceive the world. It also drives treatment. The real purpose is to determine what sort of interventions will be most effective for the person.
It wouldn't benefit me in any way to be told you have this personality disorder, or there's something wrong with your personality here, or your personality has this flaw there. Would not serve me well. And I think that's a lot of what NLP would guide us down the road of, that it's your beliefs. Beliefs are there to serve you, and if a belief doesn't serve you, then just get rid of it. So having a diagnosis wasn't one of those 15 that I rely on. It was exercise, it was meditation, it was doing this and talking, really, and groups, and basically, getting it out, rationalizing things, talking it out, getting the feelings to the surface and getting things out are probably the most helpful. But getting a stamp and a label on my forehead that says, we've extracted this element of your personality and we've put this label on it.
Is there a manner in which personality disorders are commonly diagnosed?
Yes, so they can be diagnosed in a treating environment. Treating psychologist or a therapist or a psychiatrist simply does a diagnostic interview, which involves assessing multiple areas of a person's history back down through
I'm
childhood.
going to stop you for a second.
Yes.
What's a treating environment?
Sometimes I'll slip into these words, I apologize. So
Shakespeare has this wonderful quote, which really is so simple, but it's so true. And he says, "A rose by any other name would still smell as sweet." So we get so wrapped up in labels and categories and names for disorders, and yet underneath it all is just a human being with multiple different characteristics to the personality which define their individuality and make them unique. And whether you call it one thing or the other, this is this person living out their experience with their unique outlook on the world. And certainly we need help, we need help. And a lot of the time that comes down to just empathy and people sitting there and listening to people, which is something I've done a lot of times, and it has helped me, ironically, well, not ironically, it's natural really, it has helped me to listen to other people's problems and to mutually help each other, and that's in support groups and so on. What doesn't help people, I think, are these ruthless forensic categorizations. And certainly on top of that, in order to compound it more, you have a kind of a hostile diagnosis in this case.
her scores essentially correlated, so they were consistent with other people who obtain these scores who have been shown through many studies to have these very specific traits. So externalization of blame, a lot of inner anger and hostility, sometimes that anger among these groups with similar scores, these people might have that anger kind of explode out at times. They tend to be very passive aggressive. They may be self-indulgent, very self-centered. They could use manipulation tactics to try to get their needs met, very needy of attention, acceptance, approval. They tend to distance people who are close to them. Initially, they may seem very charming. They're very socially sophisticated, actually. That was a major component on there. They have a capacity to kind of offer some of their faults, but in a way, but only the ones that people think of lightly and can all relate to. Which in my opinion really gives a very bad name to the whole field of psychology. And, you know, there already is that problem out there. And a lot of people, you know, there's this old joke of somebody says they're a psychologist at a party. People say, oh, you're analysing me already, aren't you? You're analysing everything that I'm doing. And which is kind of rubbish. I mean, usually it's not true. But this kind of backs up that kind of old trope that psychologists are in some way insidiously analysing people in order to put them in a box so that they can put a label on them. And they have somehow in the factory put the good machines and the bad machines. And there is that trope out there. A treating environment in therapy, if somebody is going in for treatment, the mental health provider will ask them questions to find out what sort of symptoms they've experienced and what sort of things have occurred in their life that might be consistent with these disorders, or rule out these disorders, prove that there is no reason for these disorders to be considered. They might also pay attention to their observations of the client over time and new information the client provides them. The most reliable way, however, to ever come about a diagnosis really is through a comprehensive psychological assessment. And I might use the words assessment, examination, testing interchangeably. They all mean the same thing. It's combining information from multiple different...
This trial is ongoing. It's really sad in that domestic violence is part of it, which is a shocking and horrible experience for anybody to go through, certainly in the privacy of their own home. it's sad to see the polarization of people who have automatically, from day one really, before any evidence is heard, taking one side or the other. I'm kind of looking at it from a neutral point of view. And I think, well, my natural instinct, I think when the mob goes behind one side, my natural instinct is to look to the other side. And it doesn't necessarily mean that I'm looking and saying that the other side is necessarily right, but my natural instinct would be to say there's more to be heard, and that side needs to be heard. I think there's an old saying that, you know, if 100 people are agreeing, 99 of them are redundant. So there's a lot more worth in going to the side that's been kind of neglected and the mob hasn't supported, and to probe a little more there and to see if there's more to be learned. That's my analysis of, so 2 videos, analysis of Johnny Depp's diagnosis and also Amber Heard's diagnosis. If you have any comments, let me know in the comments, and I'll see you next time.